how can we do something to help mitigate people at risk, to get packages to people that need this, people that have diabetes and need insulin or need batteries for their wheelchairs. How do we do this? So we contacted the FAA, we talked to the National Guard, we talked to a lot of different organizations. Nobody really had an answer for us. Legally how to do it, the methodology or anything. So what we did is we thought if we could take drones that are owned by the average drone user and be able to do research methodology to prove that package deliveries can be done with them, then we'll be able to do things in rural America when we have floods, when we have fires, when we have power outages and things like that, and be able to do it in a safe manner in this COVID world that we live in.
The UK Centre of Excellence in Rural Health works very closely with community engagement with our community members. And one of our members, Robert Donovan, heard what was going on with the drone project, and he knows about our community health workers in Kentucky Home Place, and he wanted to connect the two. And to me, it was like it turned on a light with a bright idea. Let's be inventive. When you live in rural areas of Kentucky, a lot of times you have to be inventive to find solutions for the population that you serve. And so to me, this was a perfect match. When the UK Cares put out a call for proposals, it was the perfect opportunity for us to reach out as a community and as the Center of Excellence in Rural Health and Kentucky Home Place, our community partners, our drone partners, Bart Massey and all of his ideas, to put together a great proposal to UK Cares.
We heard loud and clear that some of the people living in the region weren't really taking COVID as seriously as they should. They didn't have access to personal protective equipment like masks and gloves and disinfectant wipes. And we thought we would marry the two ideas of the Home Place community health workers so that they would help us recruit people who might want to be part of this innovative research to really just try to figure out if drones could be used to get needed equipment to people who live in remote areas of Appalachia.
So the thing that I want to say about community health workers is that they have a heart so big it barely fits in their bodies. And they just do enormous things above and beyond what you would normally hear in healthcare, to reach out to people, to access their medication, access things that they need like handicap ramps, housing issues that they might have that need repair. And with COVID-19, the fear of just leaving their homes, the fear of being in a crowd of people, and sometimes the lack of understanding just what is going on in a pandemic keeps people isolated. However, that doesn't stop the fact that they need supplies, that they need to have the right information about staying safe and about getting the supplies that they need to stay safe.
Whatever we take them, and it'd be hand sanitizers or masks, not only are we going to deliver that to them, but we're going to train them or educate them on proper use of that. And I think that's a big problem, especially in a rural area. People may have the masks, they may have everything that they need, but if you don't use it properly, it doesn't do any good.
So that's where our community health workers really come in. They're from the counties they serve. They are excellent at interpreting the information and putting it in the right way for people to understand that they're working with.
The folks that the University of Kentucky has involved, China and Carol, are going to be huge assets here. We have a visual observer that's communicating from a site beyond, then we're able to have better safety, we're able to do things at a further distance, etc. You know, if I look at you and I say, okay, I need you to go down there and tell me if I need to go left or right. First off, is that left from your perspective or mine? And then when it's getting darker at night and at the evenings, they need to be able to look, and if they can see aircraft in the distance, know by the lights whether they're coming toward us or going away or running parallel. They'll have 8 hours in class, they'll have about 4 hours mentorship. So we're looking at ways that the average drone pilot can go through as the FAA allows this stuff to increase, to be able to go through the training and the booklets that we created and pass the certification to be able to do this. We're in the process of creating that with the approval of the Federal Aviation Administration. So we've trained 125 pilots. We went out and looked for books to do training with, and guess what? There were none. We've published 11 books since then.
What we stand to learn about the use of drones as technology that could actually bridge some of the gap and bring needed supplies, maybe eventually medication, eventually letting us sample the air and the water and the soil in these areas in a pretty cost-effective way. I think it's exciting and it's novel, and I think people around the country are kind of watching us to see what happens with this project.
As you hear of all these things that happen in the big cities, and you don't necessarily hear about inventions and innovative things in rural Kentucky. And if we can be on the forefront of that, I think it's just an awesome goal to reach between all of us.
But then on top of it, I just really like the people they get to work with. They're just a wonderful group of people, and they have the same heartfelt dedication toward this. Money can't outpay passion, and we've got passion in bucket loads.